Every time you step into a doctor's office or a hospital, you're walking into a world that's run by this hidden framework. It's a really powerful mix of laws and ethics, and it shapes every single decision that's made about your care. So in this explainer, we're going to pull back that curtain and show you exactly what's going on so you can be a truly empowered patient. And that brings us to a really big question, one that's right at the heart of all of this. Is everything that's legal also ethical? You'd be surprised how blurry that line can get, and that tension is exactly what we're going to dive into. So, to really get a handle on that tension, we have to start with the main event: law versus ethics. Now, they might sound kind of similar, but trust me, they come from totally different places and have very, very different consequences. Okay, think of it like this. The law, that's the official external rule book for everybody. If you break a law, you face actual formal consequences. But ethics, that's your internal moral compass. It's all about your personal beliefs of what's right and what's wrong. And if you go against your ethics, the consequence is usually, that heavy weight on your own conscience. So, if ethics is a moral compass, what does that compass actually look like in a hospital or a clinic? Well, healthcare professionals are guided by a pretty specific set of principles. You can think of them as their North Star when they're navigating some incredibly tough, life-altering decisions. First up is autonomy, and this one is huge. It's the core idea that you, the patient, have the right to make decisions for yourself. It's all about respecting your power to be in charge of your own life and, of course, your own body. So, what does autonomy look like in the real world? Well, imagine a terminally ill patient who is of sound mind, and they decide they want to stop treatment. Their healthcare providers have an ethical duty to respect that choice. And that's true even if they personally think another option would be better. Next, we've got two principles that are basically two sides of the same coin. First, beneficence. That's the duty to actively do good and always act in the patient's best interest. Then you have non-maleficence, which you've probably heard of. It's the famous oath to do no harm. Put them together, and you've got the bedrock of truly compassionate care. But what happens when these principles clash? This is absolutely key. When a patient's right to choose for themselves, their autonomy, is in conflict with what a provider thinks is best for them, that's beneficence, autonomy almost always wins. In the world of healthcare ethics, your right to decide is paramount. And our final ethical principle is distributive justice. At its core, this is all about fairness. It's the idea that all the healthcare resources, the benefits, and even the burdens, should be distributed equally, no matter a person's race, gender, or their ability to pay. A really powerful example of this is organ transplantation. There's a limited supply of organs, right? So distributive justice says we have to use fair, objective criteria to decide who gets one. This whole system is designed to make sure the process is as equitable as possible when resources are that scarce. All right, so we've looked at the moral compass of ethics. Now let's flip the coin and talk about the official rulebook, the law. This is where we get into what happens when things go wrong, and maybe more importantly, who is held accountable. First off, you've got personal liability. And it's pretty much exactly what it sounds like. A nurse, a doctor, any healthcare professional is individually responsible for their own actions. Simple as that. But then things get a little more interesting with something called vicarious liability. It comes from this old legal idea that basically means let the master speak. It means that an employer, like a hospital, can be held legally responsible for what its employees do while they're on the clock. And finally, there's corporate liability. This holds the entire organization, the hospital or the clinic itself, responsible for its own duties. Things like making sure they have enough qualified staff, providing safe equipment, and just generally keeping the environment safe. The institution itself has a direct responsibility to you. Okay, so we've got the ethical compass and the legal rulebook, but what does all of this actually mean for you? This brings us to the most important part of this whole discussion, your rights as a patient. Because understanding these rights is the key to being your own best advocate. Let's start with a big one, informed consent. For your yes to any treatment to be legally valid, there are 3 non-negotiable conditions. 1, you have to have the mental capacity to make the choice. 2, it has to be voluntary, with 0 pressure. And 3, you must have been given enough clear information to actually understand what you're agreeing to. So, what kind of information are we talking about here? Well, by law, you are entitled to a clear explanation of the treatment, the potential risks and benefits, and any other options you might have. And this is so important.
You always have the right to ask questions and to withdraw your consent at any time for any reason. No questions asked.
And just like you have the right to consent, you have a powerful constitutional right to refuse treatment. This right is so fundamental that you can legally protect it ahead of time in documents called advance directives, things like a living will, just to make sure your wishes are followed no matter what. Another huge cornerstone of your rights is privacy. You've probably heard of the law HIPAA, right? Well, it's designed to do one thing: make sure your medical records are kept confidential. It legally requires everyone in healthcare to take super strict measures to protect your personal health information. All right, for our last piece, let's take a quick peek behind the scenes. There are these major operational challenges happening in healthcare that, even though they might seem far away from your hospital room, can directly impact the quality and safety of the care you receive. For instance, adequate staffing is a massive factor in patient safety. Hospitals have a clear legal duty to provide it, and the law is really firm on this. Being short-staffed is never a valid excuse if a patient gets hurt because of negligence. That's a critical legal protection for every single one of us. After all this talk about liability and rules, this quote from the American Nurses Association's Code of Ethics really brings us back to what matters. It's just a powerful reminder that beyond all the legal stuff, the real goal is to treat every single person with compassion, dignity, and respect. So we kind of end where we started, but now you've got a new perspective. You have a much clearer view of that hidden framework of law and ethics in healthcare. So the real question is, how are you going to use this knowledge to be a stronger, more confident advocate for yourself